Hey guys, it's Caroline bringing you guys this week's patient update. We are so overloaded with patients, which is great. I think TRC has never had this many patients before all at once, so we are extremely busy, but we have some new and exciting cases to talk about, so let's go ahead and get into it. First up for this week, we have the release of red-tailed hawk 61124. This bird came into our clinic with a fractured ulna that healed wonderfully. After passing live prey testing, our wonderful CEO Amy had the opportunity to release this bird back to where it came from. We wish the best of luck to this patient. Next up this week, we have Golden Eagle 71624 from Granger, Wyoming. This bird came in as a failure to thrive case. What this means is that sometimes in the wild, baby birds just don't do well due to the fact that it's really hard to survive as a wild animal. These cases are always very rewarding for our team because we feel as though we can give them a second chance at life. After getting some supportive care for the last few weeks, we transferred this bird to a falconer that Teton Raptor Center has an existing relationship with. Unfortunately, our flight barn is not well suited to flight condition a young golden eagle due to the fact that they need a lot of space to stoop, dive, and bank turns during these formative months. The falconer will ensure that this bird is well conditioned to fly, as well as teach it how to successfully hunt. In 6 months, we will do a health check on this bird and outfit it with a transmitter and release it. Up next, we have Bald Eagle 72124 from Wilson, Wyoming. This bird is also a failure to thrive case, and it also had a pretty large load of ectoparasites upon admission. Our team initially thought that this bird was an avian influenza risk, but after we received a negative test result, we moved this patient into our ICU out of our quarantine zone. For now, we are giving some supplements to ensure that its organs remain healthy and offering a nutrient-rich diet to put some weight on this bird. Our second to last patient for this week is Osprey 8524 from Driggs, Idaho. This fledgling was found in the road and was picked up by a group of lovely bystanders that called us when they didn't know what to do. Thankfully, all that our team found with this bird is some blood feather damage. When a bird grows in new feathers, those feathers have a blood supply for a while until they dry out. These feathers can be really sensitive and become painful when cracked or broken. We have this bird on some mild pain medication, and we are hopeful for a very quick recovery for this patient. Lastly, for this week, we have Swainsons Hawk 8724 from Iona, Idaho. This patient came in with some pretty severe soft tissue damage that we speculate to be from barbed wire. We were hoping to suture this wound shut, but unfortunately there is not enough viable tissue to use. Instead, we are keeping the wound very clean and moist, prophylactically treating with antibiotics, and managing discomfort with pain meds. Just to give you all an example of how loaded we are with patients, this is our patient board. And all of these right here and here are patients. As you can see, we have run out of room on this board, so we have creatively moved over to the glass panel over here. Those are all the updates I have for you guys this week. Thank you so much for tuning in. If you are curious about the status of a patient that I didn't talk about this week, feel free to call or text us at 307-203-2551. As always, if you want to do your part by keeping wild birds wild, click the link in the description to make a donation or visit our website directly. Thank you so much.